Hi, my name is Alicia Flecha, and today we're doing the oral wash validation. The first thing I'm going to do is say my 7 steps, which is to check the physician's order, wash my hands. We're going to check our equipment, which we'll discuss later. We're going to identify the patient by their patient name and medical record number. I'm going to introduce myself to the patient, explain to the patient our procedure for today, which is oral wash care, and I'm going to provide for privacy with the curtain. So for my equipment today, we have a small basin filled with water, a rinse cup filled with water, a towel, an oral swab, and gloves. So what I'm going to do first is I'm going to lift the patient up to my working position. Oh, sorry. Now I'm going to lift the patient into a comfortable position. I'm going to lift the guardrail down, the side rail down. And then because I washed my hands already, I'm going to put on my gloves. What I'm going to do is I'm going to put the towel underneath the patient. In case anything spills, it can go on the towel and not on the patient. I'm going to tilt their head a little bit so that way I can get better leverage for oral care. I'm going to open the oral swab. I'm going to take the basin that's filled with water. I'm going to put the oral swab in the water, rinse it. I'm going to go into the patient's mouth and I'm going to swab the cheeks. And then go over the teeth. Make sure to go in and swab correctly. Then I'm going to swab the outside of the lips. And put it back in the basin. Now at this point, either the patient can oral swab themselves if they have the ability to. If not, then you assist them with the swab. Now, after the swabbing, you can offer them to mouthwash. If they can do it themselves, then you allow them to. Or if they need assistance, then you would do it for them. So you would get the wash basin, offer them the mouthwash, assist them in pouring it in, have them spit into the basin. Then what you're going to do is you're going to remove the towel. I also wanted to add that if their lips are dry at the end of oral care, you can apply a wet jelly on their lips just so that way it stays moist. So now what I'm going to do is I'm going to lift the side rail up, put the patient down to their lowest position. And then I could either leave the patient like this, or if they would prefer to be a little lower, then you would lower the patient according to how comfortable they would be. And then I would take off my gloves. And then I would do away with my equipment. And that would be the end of the validation.